in a nutshell, about 80 to 85% of our expenditures were personnel costs. So at the beginning of 2008, when we faced a deficit of around $4.5 million, if we were going to succeed in getting out from under that, we had to reduce personnel costs. So we started streamlining departments. We stopped filling a lot of positions. We had basically a hiring freeze, and we also had to just unfortunately go into a layoff position. We are about 13% smaller in terms of workforce where we were before, and it's basically every single department, with the exception of the police department, has gotten smaller. In addition to having fewer employees, we've also changed benefit packages. Wages for most employees have been frozen unless they were under a previous union contract. We also renegotiated our healthcare contracts. We reduced overtime, particularly in the fire department. There were certain services that we contracted with the county, such as the health department. We started contracting with the county board of health to provide those services, which meant that we were able to provide them at a lower cost. And also Winterhurst, we ended up contracting with a private company to operate that facility. It was running a deficit of several $100,000 a year, and that has been eliminated. If you haven't been there, they've put about $1 million into the facility in private money, so that's worked out well for us. It's going to be hard to tell on this screen what you have to be Superman to read this probably from where you are. But basically what this gives you is an outline of where our money comes from and where it goes. Our main sources of revenue are our property taxes. The schools get most of it, but we get a percentage of property taxes. Our income taxes, which are our local income taxes. And then we get a certain amount of state money and federal money. And what does it go out for? It goes out for, well, I left out too, there's water and sewer rates too. Now, what do they go out for? They go out depending on what they come in for. So if it comes in as a water or sewer charge, it has to go out for those same purposes. If it comes in as income tax or property tax, it can be used, bless you, it can be used for any purpose whatsoever, basically. And there's some refinements to that, but overall, that's basically what it is. Our overall budget is about $100 million, but that includes everything, including all the water and sewer. Your actual operating budget is only about $36 million when you talk about personnel in most departments. Okay, let's keep going. This is, again, it's going to be hard to read on this size screen, but this, you're going to have to trust me that this is what this graph says. Basically, what this means is that starting at about 2001 or so, the income of the city was less than the expenditures of the city. Now, some people say, well, don't you have to pass a balanced budget? You can pass a balanced budget, but it doesn't mean that you can't spend money that you had in surplus. So to explain it like in household terms, you could be spending more per month on your mortgage and all your incidental expenses than your income are, and you can sustain that as long as your savings account will allow you to do that. The black line is basically what our savings account was. If you see the black line, and you can see it plummeting, and that's starting in around 2005, 2006. And it plummets because you have expenditures outpacing revenues, but and the reason that was sustained at the time was because the savings of the city, which had grown to about $5 or $6 million in our general fund, were depleted almost down to nothing. At one point, only about $32,000 budgeted for 1 year. Now, how does that compare to other cities, or how do we compare that? Sometimes you hear Congress talking about trillions of dollars, and we're talking about millions. All I can tell you is most financial experts or municipal finance experts will tell you that you ought to have in reserve around 3 to 5% as a minimum. So when we were around $40 million for our general fund, and now we're down to about $34 million, but one time we were about $40 million, we should have been at least around $2 million or so in our general fund. You know, if we've been 10%, we would have been at $4 million, so 5%, we should have been around $2 million, and that's a minimum number. There's plenty of suburbs that are much higher than that. Now, there were a few suburbs that were lower than that, and they've all had terrible financial problems. One was East Cleveland, which was put under state control, basically, their budget, because the state auditor's office will come in and they will take control of your finances if they believe that they're at risk. The other city was Garfield Heights, and Garfield Heights, the same thing. The state came in and said, you are projecting too big of deficits and you don't have any reserves, so we're going to come in and we're going to help you set your budget. You don't want to be in that position, because you want to be able to make your own decisions. You don't want somebody from the Attorney General's office in Columbus or the Auditor's office in Columbus helping you to make your decisions. So we wanted to avoid that, but we were really on the cusp of that possibly happening. Now, what's happened in the last 3 years? We just passed our third budget. It's the first time in about 15 years that we've had consecutive budgets where we're spending less than we're bringing in. And what that means is, for the first time since about 2003, we have a more than $1 million surplus for the 2010 budget. Now, some people say, well, great, if you have $1 million, then fix my street, or whatever, fill in the blank, whatever they want you to do. But you just can't do that. Any more than a household can spend everything that comes in with a paycheck. You have to have some kind of reserve, or else you're playing Russian roulette with the future and hoping that nothing goes wrong. So we're going to build our surplus up to a reasonable level, and we set a 4-year goal, actually, of getting to $1 million, and we did it in 2 years. So we're proud of that. We're not forecasting any major change in services or anything of that nature for 2010. And we're different. Again, it's these other suburbs that didn't make those choices a couple years ago. Those choices are now being forced on them. And that's why you see a lot of if you pick up the paper, you'll read about a lot of layoffs that are coming in other cities. So gradually, our surplus was going up. This is just showing our healthcare expenses. We had about 10 years straight of increasing healthcare expenses. Any of you that pay those costs in a small business or have to be aware of that know what's happened in healthcare recently. We had, for a while, we were averaging double-digit increases. So we had a couple years where we had a 12% increase, followed by a 10% increase, and it's just not sustainable. I mean, the city would go bankrupt if that continued to happen. And we've had, actually, next year will be our 3rd year in a row of declining healthcare costs. That's for 2 reasons. One is we got more aggressive about negotiating for better reimbursement rates for medical mutual. That was part of it. And the second thing was we did ask city employees to make sacrifices in terms of the benefits packages that they have. Most of the employees had basically 100% coverage plan. They contributed something to it, but it was 100% coverage. And we asked them to go to a 90-10 plan, which is still a generous plan. All the non-union employees, including myself, did that at the beginning of the administration, and it is slowly being implemented as we reach agreements with other unions. So we've reached agreements with 3 unions now, and all 3 unions have switched to that plan, and that's saving us a lot of money. We're still in negotiations with a couple others, but with the police and the fire union and firefighters union, and that's what we're going to be asking them to do. And that's really become the standard in the industry, and I anticipate that's what will end up happening. We did do something a little bit differently than other suburbs, and let me tell you what it is. With most other suburbs, when they were facing their deficit situation, if the deficit was $4 million, they would cut $4 million, and they would try to limp along to the next year and hope that the next year was better. The problem with that approach is, if you have a certain need in the community that is absolutely pressing, you have to tell people you'll just have to wait till the economy turns around. So, one of the things that I've enjoyed doing is getting to know some of the other mayors across the county, and I can tell you many of them had to cut in 2008, 2009, and they're cutting again in 2010. And the reason is because they didn't truly reduce their operating expenditures. Let me tell you what I'm talking about. If you have 500 employees and you figure out that if you get each of them to take 5 furlough days, and you can save $1 million, and your deficit is $1 million, and that's the way you address your fiscal problem, by the time January 1st comes around the next year, you're right back where you were before. You have the same operating costs. Now you have to go back to the same employees again and say, can we have 5 more furlough days? This is what's happening in many, many, many cities.